Rich, if you'll get us started, I am in an environment that's too loud behind me, so I need to turn this off, but you can go ahead and get started anytime. We'll get.
Well, can you hear me?
Yes.
Because I can barely hear you folks. Lynn, are you ready?
Yeah, I sure am.
All right. Good afternoon, everyone. My name is Rich Siegel. I am the co-chair of the Health and Wellness Committee at the Austin LGBT Chamber of Commerce. We're very happy to have you with us today. We're going to tap into the expertise of Lynn. She is going to talk about health insurance options coming up for 2022. I apologize, I'm a little late. The technology got to me a few minutes ago and I wasn't able to hear anything. So I had to log in again. That's why we're starting just a few minutes late. Lynn, I appreciate the fact that you are here today and look forward to learning a whole lot about the coverages that are being presented to people for 2022. And without further ado, Lynn, if you are ready to go, then I turn the program over to you and we'll talk again to you before this webinar is over. And Lynn, again, thank you very much for being with us this afternoon.
You're welcome. Thanks, Rich. And to the Austin LGBT Chamber for just organizing here and letting me share information about health insurance options with LGBT Chamber members and their employees and their community members. And I'll just start with a quick overview. My name's Lynn, y'all. I work for a nonprofit organization here in Central Texas called Foundation Communities. And my pronouns are she and her, in case any of those come up in the chat. If y'all do have any questions about the material that I'm gonna introduce to you here today, or maybe define a little bit further if some of y'all have already looked into public health insurance options for employees or their families, feel free to go ahead and use the chat. I'll stop a couple of times in mid presentation to check and make sure that we're all on the same page and whatnot. So Foundation Communities is primarily known as a nonprofit affordable housing organization in Central Texas. We've got somewhere, I think we've got like 24 or 26 affordable housing sites in the Central Texas area and a couple up in Dallas also. And in those affordable housing sites, there are professional services and community services organized to make sure that residents have all the information and resources that they need to be financially successful. And then we also have those programs available for community members at large as well. So we've got a financial wellness program, a college hub, a free tax help program, and then the program that I work for, which is health coverage. So the reason that I'm giving you this context is just to help explain a little bit that Foundation Communities is not a health insurance provider. We don't sell health insurance to anybody, but we are certified by the Federal Centers for Medicare and Medicaid Services to help individuals and people around the state of Texas understand what their options are in health insurance and in other health coverage programs. So the health coverage programs that I'm going to focus on today are available to Texans through the federal marketplace. The marketplace is also known as healthcare.gov. That's the federal website or the federal platform where people can go to access their public health insurance benefits. It's also called the Affordable Care Act. Also was widely known for a long time as Obamacare. So I'm going to discuss those public health policies with folks on this call to make sure that people have full pictures of the benefits that are available out there for themselves and their employees, so that employers and small business owners and folks associated with the LGBT Chamber can make informed decisions moving forward about the best options for themselves and their employees with regards to their health coverage. And then, because health coverage is so expensive, if people do find money-saving options on the federal marketplace, then oftentimes those savings, some employers will use them to create other kinds of employee benefit plans or programs, right? So if you end up saving, $10,000 or $15,000 a year on funds that you would have been spending on employee health insurance had you gone with a private plan, if you switch over to the marketplace and then have those savings available, then some employers will pump those into other employee benefits plans like fitness plans or counseling plans or all kinds of different perks that people can purchase for their employees in order to attract folks, because as lots of people on this call know, we're in a difficult hiring environment right now, and employee benefits plans and programs can be really helpful to employers and small businesses, entrepreneurs and so forth, who are creating employee bodies in order to, get work done. So I'll start my presentation here and share my screen. And let me actually do this first too. If y'all have any questions that you want to just direct to me later on, I'll share this info a couple of times. Here is the website, the program, and the program phone number in the chat box there. So that's the main organization line. I'll also share my direct line in case anyone wants to reach out to me directly. But there it is for folks who are joining now virtually. And I'll share my screen here so that we can get started. All right. Okay, so just an intro slide here. And then today's topics that we'll be talking about, we already started a little bit, right? Employee benefits programs and health insurance. And then we'll focus attention today on the federal programs for public health benefits, also called Marketplace Health Insurance, also called Affordable Care Act. We'll discuss limited benefits plans just very briefly. They are out there. They do offer some kinds of financial protection for individuals, but they don't offer comprehensive protection for employees or their families. So we'll discuss what those things do. Feel free to ask me any questions about them. And then we'll talk about eligibility and financial assistance available for folks for comprehensive plans on the public marketplace. And when I say comprehensive, I mean plans that offer guarantees to insured individuals, right? So we'll make that distinction a little bit together. And then we'll focus a little bit on the American Rescue Plan, which for anybody who was following the news back, in March or April of this year, the American Rescue Plan Act passed Congress and has been kind of primarily known for creating a second or a third round of stimulus checks that went out to some folks. I think they were for $1,400. They also expanded the child tax credit, which people were able to take advantage of when they did their 2020 taxes this year. And then, of course, now related to our topic today, the American Rescue Plan created significant benefits, significant changes in public health policy, especially to make public health insurance plans more affordable. So we'll talk about those policy details, and then we'll have a quick Q&A. If anyone has any questions, oftentimes the big question is like, how much does a plan cost, right? And what we'll talk about today and learn a little bit together is that there are so many different factors that go into health insurance options for individuals and for their families that there's really no one set cost, right? And so the answer to that question and many others is usually just give us a call, let us talk with your employees, whether it's in a group setting or individually, one-on-one, and we'll help you and the employer and also them, the employees, figure out what their best options are moving forward. So let's see here. We will start with just this is the platform, right? This is healthcare.gov. This is the website that we all use every day. I mean, we in our program to make sure that we can access public health insurance benefits for folks. So the Affordable Care Act was passed in 2010, and it exists to fill a big hole in the public or in the health insurance market. So just a little bit of history here. Since the 30s and 40s in the United States, health insurance has often been connected to employers, right? So people had employee health insurance through big employers. And if people didn't work for a big employer, or if they worked part-time and didn't qualify for that employer's health insurance plan, or for people who were self-employed, and then of course also for people who are not working, if they're in between jobs, or if they rely on Social Security income or investment income or retirement income. If people aren't 65 and qualifying for Medicare, then they just didn't have an offer of employer coverage unless they had something kind of like rollover from a past employment circumstance. But for small business employees, for self-employed folks, that just didn't happen. There just weren't options for them. So it was revolutionary in 2010, the Affordable Care Act that passed then and created this market at healthcare.gov. It's called a public-private partnership, the Marketplace or the Affordable Care Act, and that's because the public entity that is the US Treasury, depending on a family's income and household size and some other factors, will actually help individuals and families pay for their health insurance premiums, and sometimes even for their cost sharing reductions. And we'll talk a little bit about cost sharing reductions, but those are co-pays deductibles, and out-of-pocket maximums. So the public entity that is the US Treasury will help people pay for their health insurance costs if they fit within certain income guidelines. And those income guidelines are expanded due to the American Rescue Plan. And then the private part of this public-private partnership is private insurance companies who sell insurance plans on this marketplace on the healthcare.gov website here in Texas. Some states decided to build their own website, their own exchange between the public entity that's paying for the private health insurance plans. But Texas did not. So we use the federal platform, which is fine. It works. And so people purchase private health insurance plans on this platform, and the US Treasury will help them pay for it, oftentimes, depending on where their incomes are. So that's kind of like the basic structure of how this whole system works. And this system made it possible, again, for people who were self-employed, people who were small business owners and employees, folks who were part-time employees and didn't have offers of employer health coverage, and for people who were not working at the time to have access to health insurance for the first time ever, really. So this was a huge policy change, and it made it possible for programs like ours to help people access their public health benefits. And so importantly, the financial assistance that people get from the US Treasury is not like a SNAP benefit or like an affordable housing benefit. This is just financial assistance that people qualify for based on their incomes and based on their employment status. So there's no tax hit to accepting this financial assistance. We'll talk a little bit more about how it works here in a few minutes. I've got some examples to show also, but just for the background's sake, this is the platform that allows the public entity to help people pay for private health insurance plans. And that's the big revolution of the Affordable Care Act. And then there are also some standards built into the Affordable Care Act that were huge game changers in the world of health insurance, right? So guaranteed issue is another way of saying that insurance companies cannot charge individuals more for health insurance premiums, like how much they pay per month, if somebody has a pre-existing condition. So the insurer must guarantee to issue a person a plan that costs the same as if they didn't have a pre-existing condition. So this is huge also for people who maybe had oncology diagnoses, or for people who have long-term conditions like asthma or diabetes. There's no way that the public entity, there's no way that the private plans available through the public-private partnership can charge them more, because consumers or individuals are protected by the guaranteed issue protection. Also down the list here, the Affordable Care Act set up minimum standards. So insurance companies have to pay a minimum amount for people's care, depending on which cost of plan people choose. And then of course, there's the financial help for monthly premiums and cost sharing reductions that we talked about a little bit already. The development of the health insurance exchanges, that's healthcare.gov that we use in the state of Texas. And then also essential health benefits are built into every marketplace plan. So essential health benefits include the policy called mental health parity, which means that marketplace health insurance plans cannot charge individuals more than the cost of primary care for mental health care. And that's in an effort to shore up the mental health care industry in the United States and really get people to recognize the values and the benefits that can come from using mental health care. So the insurance plans themselves have to charge primary care prices for mental health care. So that was a big deal. Also, all preventive care is completely free. That is an essential health benefit built into the Affordable Care Act. Emergency care anywhere in the United States has to be covered at in-network costs if people have life-threatening illnesses or injuries that happen while they're outside of their insurance networks. And I'll go into the plans a little bit that are available in 2022 on the public market. But so these are just some of the policies and standards that are built into the Affordable Care Act and must be in every single plan that people can purchase on the federal exchange or on healthcare.gov. And so what that does is it just provides people security, right? It gives people protections against maybe an out-of-pocket maximum that would be in place from a short-term plan that would then cap out the amount of money that an insurance company or that a limited liability plan would pay for an individual. The Affordable Care Act doesn't have that. One of the essential health benefits built into this plan, or built into all of these plans, is that there must be an out-of-pocket maximum that applies to the insured person, not to the company. So what that means is, even if somebody needs a $400,000 surgery, like an open heart surgery, or there are actually lower intestine transplant surgeries that cost over $1 million. If somebody needs one of those very expensive and very rare surgeries or provider services, then the insurance company is legally required to pay for that thing. And the individual will never go into more medical debt than is their out-of-pocket maximum, as long as they're seeing providers who are in their network, which we help people make sure that they're doing that throughout the year. So that out-of-pocket maximum is the big game changer, right? That's the thing that prevents individuals from going into medical debt or into excessive medical debt and still getting the care that they need for good health. So again, there's the out-of-pocket maximum. And here's just a couple of like unfortunate statistics. Like, medical debt is still the leading cause of bankruptcy in the United States. So we recognize that health coverage really is an issue with regards to financial security in addition to good health. And that's an important connection, I think, for employees to make as well. Like, you don't have to purchase an employer health insurance plan. You don't have to get into that, but it is really necessary for people to understand that, like, if something happens and you end up in the ER, like, an average overnight stay in the ER costs like $32,000. And so if somebody's not protected by an out-of-pocket maximum, they could go into massive medical debt, right? Which is not something that people think about. Like, often you don't like wake up and think like, oh, like, what if I get hit by a bus today or something? But these are the protections that we're trying to like make sure that the public understands, and make sure that small business employees and entrepreneurs know that these options are out there for them to prevent them from those kinds of hardship. All right, and let's see here. And there's just that kind of, there's just an example of like how expensive it can be to have one of these major medical events. And then the 10 essential health benefits are listed here. I did go over those a little bit. So here are some healthcare options for small businesses listed here on the screen, right? Group health insurance plans are traditionally the ones that employers would buy into in contract with a private insurer, like the Uniteds, the Blue Cross Blue Shields, the Aetnas, and so forth. And then employers would pay for a portion of an employee's monthly premium, and perhaps sometimes for their spouse also. And then the employee pays for the rest, whatever that looks like. And so the more the employer pays, oftentimes the more affordable that plan would be for the employed person. And then that puts together an excellent health insurance benefit for that person, for that employee. And there are also then shop plans available through the federal marketplace. Those are health insurance plans built specifically for small businesses. So small businesses who don't have the volume of employees that they would need to build one of those contracts with a private health insurance company can go through the federal marketplace, same website, healthcare.gov, and see what their options are for small business plans. But what we've seen oftentimes unlock greater financial assistance for employees is for employees to purchase individual plans through the public marketplace. Now, and then listed on the bottom here, those 5 options, we've got limited benefits plans, short-term plans, catastrophic plans, primary care subscriptions, healthcare sharing organizations. These are all what are called sometimes skinny plans to categorize them. Other times they're called junk plans, right? And it doesn't really, I'm not here to like make value standards about the benefits of limited benefits plans or anything, but the thing that's important about them is that they oftentimes do not offer an out-of-pocket maximum for covered people. So if you're on a short-term plan or a limited benefits plan and you end up needing that $400,000 surgery, then the plan itself will max out. Depending on how much people pay for it, the amount at which it maxes out varies, but the plan itself will max out. And then the individual is responsible for covering the rest of that thing, whatever it is. And then also any follow-up care that they might need, and then any therapy that they might need, and medications, right? So the reason that we highlight these kinds of plans is because they don't offer the same protections as the Affordable Care Act does, or as marketplace health insurance plans do. So, like if somebody is on a short-term plan or a limited benefits plan that, and this happens often, that just like doesn't have an oncologist in network, then if that person develops a kind of cancer that requires oncological care, they just don't have a benefit for that, right? Whereas through the public marketplace, one of those essential health benefits is that if a doctor determines that a procedure is medically necessary for an individual, the insurance company is legally required to cover it. And oncology care, of course, is medically necessary for people who have cancer, right? Diabetes medications are medically necessary for people who have diabetes. So the protections of the Affordable Care Act prevent people from getting into these short-term plans or limited benefits plans that don't offer the same protections. And so the group health insurance plans that we talked a little bit about here at the beginning that kind of like offer the traditional health benefits for employers, what we've seen since the American Rescue Plan passed back in March is group health insurance plans actually costing employers more money than it would for an employee or for a group of employees to go through the federal marketplace as individuals. So this presentation isn't honestly isn't relevant for employers that have over 50 employees, because the federal government requires big businesses or businesses that have over 50 employees or either full-time equivalent or part-time equivalent to 50 full-time employees to provide health insurance plans for those employees. And if the plans, if they either don't offer health insurance plans to their employees, or if those plans are unaffordable or inadequate, then the employer actually gets fined. So it is in the interest of small businesses that have over 50 employees to get into a group health insurance plan. And there are lots of options out there, and there are lots of agents and brokers to talk to about those. But for people who have less than 50 employees, what we're seeing since the passage of the American Rescue Plan, as there has become more financial assistance available to folks to purchase health insurance, that it's oftentimes more affordable for businesses to send their employees to the federal marketplace to get health insurance plans as individuals or as families, of course, if people are in family structured tax households, and then use the money that employers were spending for group health insurance on other benefits, right? And again, you can talk with all kinds of benefits organizations about the different employee benefit plans that you can arrange for them, but just to make the employer more attractive to the pool of people who are looking for jobs, this can be a way for employers to help save money and offer those other benefits rather than spending all their money on group health insurance plans. And this isn't across the board, right? Like, we're not here to say, like, get into a marketplace plan. Like, the group health insurance plans are too expensive. Like, it really just depends on the employer, like how many employees they have, what kind of benefits they need or want, and so forth. So we're just here as a resource, right? We want to make sure that small businesses, entrepreneurs, self-employed folks, unemployed folks right now know that this program, that this system is out there, and to just consider it as they're thinking what's best for me and for my employees. And so here's just a little bit about the Affordable Care Act in general. So you'll see at the top right here of the screen, pre-ARP ACA, it's a lot of acronyms. That's the Affordable Care Act, the ACA, before the American Rescue Plan passed in March of 2021. So before the American Rescue Plan passed, we had people, and this still stands now, but people who are not eligible for marketplace coverage at all include people who are undocumented, so people who don't have Social Security numbers in the United States, or don't have some kind of documentation status that is current with U.S. Customs and Immigration Services, and then people who are eligible for DACA or DREAM Act services or recipients of those policies, right now are not eligible for marketplace coverage, but there are people who are trying to work on that kind of the policy, right? So if you do have Dreamers as employees, then the marketplace might not be the best option for them right now. But as we see changes in the policy, given a new administration, that might be possible later. So do keep in touch with us so that we can help you make that assessment. And then people who are incarcerated are not eligible for marketplace enrollment, but once people are released from incarceration, they do become eligible for special enrollment outside of the open enrollment period, which I'll talk a little bit about later. And then folks who are eligible for Medicare Part A. So for the most part, that's people who are over 65 and have worked in the United States for over 10 years. Some people are eligible for Medicare earlier, depending on if they have like certain kinds of medical conditions, but in general, it's for folks who are retired. And then on the right-hand side of the screen here, you'll see people who are eligible for financial assistance. So that's the money from the US Treasury that helps people drop the cost of their monthly premiums and sometimes of their co-pays, deductibles, and out-of-pocket maximums. So in order to be eligible for financial assistance, then somebody must not be eligible for other qualified health insurance. So that would be like through an employer, if an employer did offer an adequate and affordable plan through Medicaid or through Medicare. So let's see, if anybody on this call or anybody who watches it later does have employee health insurance available right now, If you did drop that plan because because you had long conversations with your employees and realized that there were better options for them on the public market, then they would no longer have that offer of coverage from an employer, and they would be eligible for financial assistance on the public market. So that's one of the big qualifications in order for people to qualify for that funding from the U.S. Treasury. And then the second thing here is that people have to promise that they'll file taxes, and that's because it's public money, right? That helps people pay for their monthly premiums and for their cost sharing reductions. And so there is an extra tax form to fill out. Again, it's not like a tax hit. But there are calculations that the IRS has to make sure that people got the right amount of financial assistance, which I've got examples and stuff to go into later. And then their income has to be within an eligible range, and that's listed in the bottom left in that little chart there. We don't really need to go into the chart. Suffice to know right now that range right there is no longer relevant because of the American Rescue Plan. So right now, people who make over 400% of the federal poverty line can still qualify for financial assistance to help them purchase plans on the public market. So we'll move forward from there. So here's just a quick overview of American Rescue Plan policy changes. I'll just skip the first one. It's people who got too much financial assistance in 2020 because incomes were so strained, because people were on unemployment benefits for the first time in their lives. People weren't really sure how that unemployment benefit affected their eligibility for financial assistance through the federal marketplace or through the Affordable Care Act. So that process was just canceled in 2020, but that was in the past. So we don't really need to focus on that one too much. But then the big two ones are increased financial assistance for low income households, which actually have dropped health insurance premium cost to $0 for some families, which is amazing. And then 3, financial assistance for middle and high income households, which I think is going to be more relevant to the folks who are on this call here today. And we'll go through again some examples here. So here we have Jose or Janie, doesn't matter, right? Because the only determiners for the cost of a plan is not gender or gender identification, but rather just age and location. So whether we've got Jose or Janie or whomever, a 34-year-old with an annual income estimate of $20,000, so relatively low income. So here we see pre-American Rescue Plan costs. So on the right-hand side there, we could see that health insurance is expensive, right? It would be $459 to insure this individual on a plan with a $0 deductible and a $2,400 out-of-pocket maximum. But the thing that makes that plan affordable to the individual is that funding from the U.S. Treasury. So with the premium tax credit, that's the financial assistance, just another term for it. For a 34-year-old making $20,000 a year, they qualify for $367 of financial assistance, which makes the premium for them for that plan $92 per month. The Treasury sends that funding to the health insurance company every month. The individual doesn't have to worry about it or be concerned with it. It just happens automatically. And then the individual pays their $92 monthly premium. Now, with the American Rescue Plan, we see increased financial assistance, right? So rather than having that $300 and some of financial assistance, this individual, based on their $20,000 income estimate for the year, qualifies for $422 of financial assistance instead, which drops their monthly premium from $90 some to $37. And so that makes health insurance a lot more affordable for individuals. And now let's see another example. That same individual on a $50,000 income, right? Same 34-year-old, regardless of gender or gender identification, making $50,000 a year. The same plan, of course, costs the same amount. We do see that the deductible increases because this person has a higher income estimate. We'll talk about how that works in a minute, but in general, the plan will still cost $459 per month, right? The cost of the plan hasn't changed because it's only determined by the person's age and their location. But pre-American Rescue Plan, this individual, this 34-year-old making $50,000 a year, did not qualify for any financial assistance. So that means that if they purchase this plan, they're going to purchase it for $459 per month. However, the American Rescue Plan, of course, now increases and makes available financial assistance for people who make higher incomes. So this individual now in 2021 qualifies for $104 per month of financial assistance, which means that plan price drops to $355. And over the year, that's $1,200 in savings. So that's, money that could go towards car repair, or home repair, or vacation, or anything really, that person now doesn't have to pay into their health insurance premiums. So here's a basic chart. This chart in front of us is the same one that we saw on that previous page, the income brackets where individuals would qualify for financial assistance. But then we see on the right-hand side there, new financial assistance available because of the American Rescue Plan. And there is an end date on this financial assistance right now. Technically, it's set to expire at the end of 2022, but historically, what we've seen is as health insurance benefits become available to people, it's really difficult for administrations to pull them back, right? So what we're anticipating, and we'll keep everybody posted, like if this changes in any way, but what we're anticipating is that extra financial assistance being available to folks after the end of 2022 also. But it will certainly be available for next year. And we'd love to, talk with employers and their employees about what that might mean for them and what kinds of benefits people qualify for based on that new financial assistance for folks who have middle and high incomes. All right, now cost sharing reductions. This part of the policy is still the same. All right, I do see that we have a question. Oh gosh, Jory, still no expanded Medicaid, no. So Jory just asked a question in the chat about Medicaid expansion in Texas, and the Texas state legislature, again, this session decided not to accept federal funding in order to expand Medicaid up to the poverty line. So what that means is that there are millions of people in the state of Texas who don't have the same kinds of intellectual or developmental conditions that would qualify them for Medicaid, and they also then don't have access to expanded Medicaid that would make them eligible based on their low incomes. So there is federal funding available for Texas politicians to take that and expand Medicaid to people who have low incomes, but the state of Texas has not done that yet. There are many advocacy groups working to make that change. If anybody wants to reach out to any of them, I have contact info. Every Texan is a great one. There's also the Coalition for Texans with Disabilities. There's lots of groups who are working to change that. But unfortunately right now, we still don't have Medicaid for low income folks in Texas. So let's see. Cost sharing reductions, right. So usually, so here's the bracket. If for incomes, you can see the household size on the left-hand side there. As household sizes increase, the government and the Affordable Care Act recognizes that it costs more to raise a family. So the thresholds for accessing this extra pool of funding have increased for bigger households. So here is the chart that shows where people can qualify for what kind of cost sharing reduction. So cost sharing reductions are just another pool of money. So there's the pool of money from the US Treasury that drops monthly premiums for people who qualify for that funding. And then there's the pool of money that drops cost sharing reductions for people who qualify for them. For a household of 4 making between $26,000, $26,200 and $65,500, they would qualify for reduced copays, reduced deductibles, and reduced out-of-pocket maximums if they choose a certain kind of plan. So let me just give you here, that's just kind of like, these are the 3 cost sharing categories. If people's incomes are in the yellow category, they qualify for the highest reductions. If people's categories are in the middle, in that pink category, they qualify for the middle reductions of cost sharing costs. And then in the green category on the right, they do qualify for some cost sharing reductions, but it's the least amount just based on their higher incomes. And here's an example to help explain some of that. So we have Mo here, a 36-year-old person with an annual income estimate of $18,600. So if that person made $50,000 per year, they'd be in the right-hand category here. So that person would qualify for some financial assistance to help them pay for their monthly premium, but they would not qualify for any cost sharing reductions. So their deductibles, out-of-pocket maximums, and co-pays for a good affordable plan, the deductible would actually be $5,450. The out-of-pocket maximum would be $8,400. So that means that's again the protective ceiling that prevents them from going into major medical debt if they do need some kind of expensive surgery or treatment or something. And then you see primary care doctor visits would cost $20, and so would mental health care visits because of that mental health care policy that we talked about earlier. And then generic medications would cost $35. Now, that would be if Mo had a $50,000 income, right? But because we know that Mo's income is $18,600, Mo qualifies for cost sharing reductions in that first category. So that means that his deductible or her deductible for this plan or their deductible is actually $0, right? So as soon as the person needs some kind of like x-ray or laboratory test or anything that's ancillary to just the doctor's office visit themselves, the health insurance company starts paying for that immediately, whether it's to the tune of like 90% or 80%, and then the individual pays for that other part of the cost sharing. Regardless, the deductible is $0. And then we see that individual's out-of-pocket maximum is $1,400, which is wild. It's like very low for people who have low incomes, these out-of-pocket maximums. So if that person needs a $400,000 surgery, as long as they're getting it in network with one of their in-network providers, the maximum that they're going to go into medical debt is $1,400, which is still a lot, for an individual who's on a $19,000 annual income. But regardless, these are the protections that are built in there for folks who do have low incomes. And then see also that primary care doctor visits cost nothing to this individual. So they can go see a doctor to get all the preventive care that's always free, of course, to get, if they sprain an ankle. All of these provisions and protections are built in the interest of people learning how to use their health insurance plans and getting used to that, so that then when they go on and make more income, they'll be stable in their knowledge of like how to use the health insurance industry to their best benefit. All right, so here is an important announcement. The open enrollment period for marketplace plans is November 1st to December 15th. And the reason that we're having this webinar in September is to just like allow people to prepare for that, to talk to their employees, see what their best options might be, and then reach out to us, if you'd like a group presentation or a group kind of like talk or one-on-ones or something with your employees, with our health coverage experts. So for people who are unemployed, self-employed, entrepreneurs, small businesses who don't have offers of coverage for employees, the time of year to enroll in public health insurance plans with financial assistance, if folks qualify for it, is from November 1st to December 15th. Now, after that December 15th deadline, people need qualifying life events in order to enroll. And that's like, if somebody's working for Dell or the University of Texas while the open enrollment period is in session, and then say they quit their job or lose it in February of 2022. If you lose your employer coverage because you lose your job, then the marketplace recognizes that that's a qualifying life event, and you can enroll in the middle of the year outside of that open enrollment period. But for people who don't have offers of coverage from employers, that's the window. It's a 6-week window. It is tight. We are getting a little bit of chatter that window might be extended to January 15th next year. But for now, because we haven't gotten confirmation, we're sticking with this 6-week window as far as we know. And then our program also did just receive a big federal grant so that we can increase or expand our enrollment assistant helps. We will have a lot more enrollment assistance available this year than we ever have before. So it's always been kind of a mad dash during open enrollment to help enroll thousands of people across the state of Texas. And we've just gotten some funding to expand our capacity, and we're really excited about that. So we're also really stoked to work with small businesses and self-employed folks to make sure that their networks, their professional networks, and their colleagues know what's out there for them in like small group sessions and one-on-ones and all kinds of things. So these are the dates coming up that are important. This is just a kind of like overview again of the original Affordable Care Act and then the American Rescue Plan. I'll just skip that one. And here I just wanted to give you all a couple more examples, right? The American Rescue Plan offers financial assistance to people whose income is under 150% of the federal poverty line. So again, these are folks who have low incomes. Before the American Rescue Plan, we can see that this individual over the course of 12 months would pay $646 for their health insurance plan. But after the American Rescue Plan, the US Treasury actually pays for the whole thing. So this 27-year-old with an income of $18,000 pays nothing for health insurance each month. And that's on a plan that could have a $0 deductible or a $250 deductible or something like that. So these are really affordable, excellent plans. Now, the monthly premium for this person, right, dropped from $54 per month to $0 per month. For a person who's on an $18,000 income, that's important, right? Now here we have an example of a family of 4. So we've got a family of 4 making $60,000 per year, estimated between the two income earners in that family. So that family was expected over the course of this year to pay $379 total for their, $379 per month for their health insurance plan. But with the American Rescue Plan, we see that cost drop to $158. So that's like over $150 of savings for this family. So that's a really important distinction for them as they move forward and are, like planning for college and for summer plans and all that kind of stuff. And then here is the slide that is probably the most important, and probably also the most important for the people on this call whose employees make middle to high incomes. So initially, this 60-year-old who is self-employed and makes $60,000 a year, Marcus here, did not qualify for any financial assistance to help him purchase a monthly plan. So that means that at 60 years old, this person's paying $957 per month on a $60,000 income to pay for health insurance. Now, the American Rescue Plan, of course, created financial assistance for this person to the tune of $532 per month. So that means that this person is now no longer paying $957 for a plan, but is paying $425. And that's an annual savings of $6,300, almost $6,400 per year, which is just huge for people who have never qualified for this kind of financial assistance in the past and do for the first time. And it's also huge for small businesses, because if you're paying $5,000 per year for a person's health insurance and they're still paying $100 or so per month, it might be better for people to offer them maybe like a health savings account that has funding in there so that they can pay for health coverage costs, but still take advantage of the public benefit through the US Treasury that they qualify for. So that means, so this person is paying $425 per month for this plan rather than $957, which is just way more affordable, right? Here is a list of health insurance plans available in the Central Texas area. So you can see we've got 6 of them this year. We're adding Aetna next year. And when I say we, I mean Aetna decided to enter the Central Texas market as an option for folks. So there are many options available to folks in Central Texas. Now, as people get out of Central Texas, if people on this call or people who watch this video later have employees who are out in kind of like more remote parts of Texas, the number of plans available in remoter areas does tend to drop. But if people have 1 or 2 plans to choose from, we can still help them see what their best options are and find an affordable option that's out there. So again, the marketplace open enrollment period, the 6-week period for right now is November 1st to December 15th. We do have phone appointments available. So we are really looking forward to seeing people in our 2 Prosper centers. Again, one's in North Austin and one's in South Austin. And we love working with clients in person, but just due to Travis County being back in stage 5 COVID restrictions, we're still working with people over the phone. But like I mentioned, if you do want a kind of like, health coverage overview or presentation with employees, how this process works, how they can get connected with our experts, we are seeing people over the phone right now, which has been really awesome. Also, like people don't even have to leave their morning coffee in their kitchens to sign up for a health insurance plan, which can be really beneficial for folks. Here's some information. I'll make sure to get all of this to Rich and Stephanie also so that they can send these things out to folks if you'd like these details. There's also online appointment scheduling. You can go to our website. I put it in the chat earlier. And then just to kind of like pitch our other programs also, the health coverage program is listed here on the bottom of this page. But we do have financial wellness programs, tax help programs, and college programs or employment assistance programs available for folks as well. So our financial wellness program pairs individuals up with financial coaches so that folks can learn how to do things like plan for retirement or open up investment portfolios or get out of student loan debt or whatever. So if that's a program that any of your employees might want to take advantage of, just let them know that it's out there. And these are all free services. And so at Foundation Communities, we just want to make sure that people know that they are out there and use us as a benefit, for your employees. Granted, this is a benefit that everybody qualifies for because they're in the state of Texas, but we advise folks to let their employees know that these programs are out there. The tax help program helps people maximize their tax refunds when they do their taxes. The College Hub program helps people get certifications or degrees in the fields that they want to get certified or get extra credentials in. So just know that these programs are out there. They're also operating fully over the phone and are free for Texans. And right on. Yeah, so there's the end of that presentation. I said I was going to stop here and there to answer questions. Didn't do that as much as I would have liked. But feel free, y'all, if you have any questions, use the chat. You can also use the Q&A function. Yeah, the American Rescue Plan just like really created some incredible benefits that are now allowing employers with employees who have middle and high incomes to sort of like rethink what their options are. And there might be savings out there for employers who can then, with good information and excellent intent, drive their employees to the public market since those benefits are increased.
Can you hear me?
I can.
As a retiree on Medicare, are there better options for me than the United States government?
So Medicare is a separate funding pool entirely. There are like Medicare, I mean, there are supplemental plans for Medicare that people can purchase in order to give themselves some extra benefits. But as far as the Medicare policy itself goes, I mean, like the funding is there for Medicare recipients. If you work for 10 years in the United States, then you pay in, your taxes pay into the system. And then if folks are eligible for Medicare, then they are ineligible for marketplace coverage. So if any of this looks attractive to people who are on Medicare, so one of our community partners is the Area Agency on Aging through the Capital Area Council of Governments. And they do a really excellent job helping people understand what their relationship is to Medicare, whether they've paid into their 10 years, and kind of like negotiating what the different options are. So we are not Medicare experts, but we can totally help connect people with Medicare experts who can learn about the different supplement plans, Part C plans, medication Part D plans that are available to them. And then, also depending on where somebody's retirement income is, there are assistance programs available for folks to have affordable coverage too through Medicare. So that's a long way of saying we've got great partners and would be happy to connect folks with them.
You might hear from me.
Okay, cool.
I have a good supplement. I'd like to see if I could get it for a lower cost.
Okay, gotcha. Yeah, I'll make a note of that now and connect you with those folks.
Does anyone have any questions or comments that they would like to share with Lynn? The presentation was awesome and very informative. Cool. I'm greatly appreciative of the time and effort that you put in to give us a great slide presentation today.
Yeah, you're welcome. And like I said, I'll send these to you too, so that you guys can share them out if you want to. They're free for posting and sharing widely. Yeah, I'm happy to answer questions. And if folks, can you all unmute yourselves? Let me stop this slide here.
There we go.
Gotcha. If you can't unmute yourself, feel free to ask in the chat.
Stephanie, do you have anything? They're still chipping away over there. Katie, anything from you?
Nope, thank you. That was a wonderful, very informative presentation. Insurances can be so confusing, and you said it all. It made a lot of sense.
Oh, cool. Good. Yeah, there's so many acronyms, there's so many programs, it's a lot to navigate, but I'm glad. We're always happy to work with folks. And even like right now, like while we're not in the open enrollment period, we want to make sure that folks know that they can call us to discuss like COBRA options, right? If people have recently been laid off from jobs, like the world of COBRA is confusing. Navigating the applications is confusing. If people have had recent income changes, their kids might be newly eligible for like the Children's Health Insurance Program or for Medicaid. And so there's just lots and lots of like intersecting and moving parts. And we're here to make sure that folks have help and resources to get through those complex questions with an expert.
Our next meeting and webinar, well, hopefully maybe a seminar by then based on present medical situation, is going to be on Wednesday, November 10th. That will be the second Wednesday of November. I missed our meeting this morning because I had to be the eyes of a friend of mine going to a doctor's appointment. I had to drive him there, so I missed the meeting. I believe we are going to be talking about, Katie, correct me if I'm wrong, please, boosters and vaccines. Is that correct?
That is correct. So we had a really good meeting this morning, and Stephanie is going to be working on the graphics and everything to start promoting it. And so we're going to for sure touch on vaccines and also, answer a lot of questions about boosters, because those will be rolling out soon, and I'm sure there will be a lot of questions. So, and also, we kind of wanted to put a holiday spin on it and encouraging people to do these things before all of the mass gatherings of the holiday season happens.
Thank you, Katie. I appreciate you taking care of that for us this morning.
Yeah, no problem.
The last thing that I'll mention is that the 2021 Business of Pride Gala is on December 3rd. At 6 o'clock, it is going to be at the Hilton. Please, there is a wealth of information, including how to get tickets, how to nominate people for the various awards that we have to present this year at austinlgbtchamber.com. And as Stephanie has just put on the chat there, businessofpride.com actually gets to their website faster. If no one has anything else, I'd like to thank everyone for being here today. Lynn, again, especially a special thanks to you for your presentation. You've given us a lot to think about, and we're grateful to you for that. I will say thank you again, and good afternoon to all of you.
Thanks, y'all. Good to see you. Bye.